Transdermal pain medications. Result of the OPERA study. Topical or transdermal analgesics are medications that are used to help control pain by applying them to the surface of tissues rather than taking them by mouth, injection, or other route. Topical analgesics have many advantages over other forms of pain medications. One of the main advantages is the lower level of systemic concentration and side effects. Additionally, there is often a significant decrease in the amount of drug-to-drug interactions with transdermal medications. Currently in the United States, we are experiencing an increasing number of opiate-related deaths due to accidental drug overdose. Many of these accidental overdoses occur in individuals who are using prescription opiate medications in an attempt to control chronic pain. Currently, over 100 million Americans suffer with chronic non-cancer pain, and this is actually one of the most common reasons that people seek medical attention. In 2014, there were over 47,000 deaths due to drug overdoses. Of those, about 10,500 were related to heroin, but an astonishing 18,893 of these overdose deaths were related to prescription pain medications. In response to this escalating rate of deaths related to opiates, efforts are being made to find solutions to treat pain that reduce or eliminate the need to utilize opiate medications. One of the solutions being investigated is the utilization of transdermal or topical medications. In studying this type of medication, a recent study was published by Clarity Science that demonstrated transdermal medications can have a significant impact on the amount of opiate medications necessary to control pain. The name of the study was the OPERA study. The word OPERA stands for Optimizing Patient Experience and Response to Topical Analgesics. The results of the study have been presented at multiple national conferences, such as the 4th Annual International Conference on Opioids at Harvard Medical School, the American Academy of Pain Management's 26th Annual Clinical Meeting, and Pain Week National Conference in 2015 in Las Vegas. The results of the study have also been published in such peer-reviewed journals such as the Journal of Pain Research and Postgraduate Medicine. Additionally, the study demonstrates a significant decrease in the use of over-the-counter and prescription nonsteroidal anti-inflammatory medications, also known as NSAIDs. While not as common as opioid-related deaths, NSAIDs do have a significant risk. The most commonly recognized risk is the risk of GI bleeding. It's been estimated that approximately 3,200 deaths occur annually secondary to NSAID-related GI bleeding. Chronic NSAID use is also thought to significantly increase cardiovascular risks such as heart attack, congestive heart failure, and stroke. Chronic NSAID use additionally increases the risk or worsens kidney disease or kidney failure. The OPERA study included 631 subjects and followed them over the course of 6 months. The study found that the utilization of topical or transdermal medications for pain control resulted in a statistically significant decrease in pain severity and pain interference scores. The level of statistical significance was such that the results indicate there is less than 1 in 1,000 chance that the results were due to random occurrence. Here are some more of the results that the OPERA study found. It found a 27.5% reduction in opioid use. There was a 50% reduction in over-the-counter and NSAID use. There was a 64.1% reduction in prescription anti-inflammatory use. There was a 20.7% and a 21.5% decrease in pain associated with arthritis and neuropathy or radiculopathy, respectively. There was a reduction in reported pain severity, symptoms, and complaints. There was a reduced interference in activity, mood, sleep, interpersonal relationships, and life enjoyment secondary to pain. The subjects had a preference to the topical and transdermal medications when compared with oral medication. And overall, there was a 92% satisfaction rate with the transdermal medications. We'd previously spoken about the side effects and adverse reactions related to some of the oral medications. What the OPERA study found was that 99.5% of patients had no side effects with transdermal medication, and those that did have side effects, of those there were no serious adverse effects that occurred. The three topical medications studied were diclofenac, flurbiprofen, and ketoprofen. Of these three anti-inflammatories, it appeared that the diclofenac worked better than the other two. In summary, the findings of the OPERA study concluded that transdermal topical analgesic pain medications are effective. They decrease the use of more hazardous medications such as opioids and NSAIDs and have very low side effects. In addition to this, they have high levels of patient satisfaction.